would like to welcome the panel speakers on dais, please. Thank you so much. Thank you, everyone. Thank you for joining us today. Again, my name is Kishore Gadiraju. I am the Chief Evangelizing Officer for TALHospitals. And TALHospitals is part of TAL Foundation. At TALHospitals, what we focus on is we find and provide pro bono healthcare services for people who needs medical care. We connect patients, doctors, and hospitals through our platform, so to provide the healthcare services. That's what we're focusing on, and I would like to request all of you to visit our website, talhospitals.org, to learn more about it. And today, again, we are focusing on a panel discussion on and healthcare and wellness. So without any ado, I would like to introduce the panel members here, starting with Shoba Rao. Thank you for joining us. She's a Stanford graduate, and she did her master's in electrical engineering. And she's also a speaker, author. She represents women in technology. She's a survivor. I would definitely encourage you to hear her journey and that she has gone through her life. I heard from her some time back, and it was very inspirational for me. So I would like to encourage you to hear from her. And she also an author of a book recently she released, My Race for Death. So definitely, you should look into that. And thank you for joining us today, Shobaji. And the next panelist, Anand Anandji. Again, thank you so much for joining us, sir. Again, Anandji, he is a professor at Stanford University and teaching or focusing on pediatrics, anesthesiology, peri-operative, and pain medicine. And he has achieved so much, I need half a day to go through all the accomplishments. He's been graduated from MGM College and Indore, and he has DPhil from Oxford University, and also he did a fellowship from Harvard Medical School. And he has so many awards, so many recognitions for his innovation, not only in the medical field, also in the community services. Thank you so much for joining us. And the next panel member is Dr. Sachin Deshmukh. Again, he is a trained doctor, physician, and he has so many certifications and diplomas in the holistic healthcare and Ayurveda and homeopathy and also yoga. He is also a CWC core team member, and he's also a yoga grandmaster. I would like to thank you and welcome all the panel members. So, before we get into the panel discussion, I would like to just have all the panel members introduce themselves, and then we will jump into the discussion.
Kishore mentioned I'm Shoba Rao, professional speaker, author, and I'm also an electrical engineer, and I've been in the semiconductor industry for 27 years now. But that said, I am here today representing more as a health advocate, and my recently published book is My Race Against Death, where I have chronicled my fight against 3 cancers. And I'm also a kidney transplant recipient for the past 25 years. So, I passionately advocate for health and facing adversities and want to spread that message around. And that's why I'm representing the panel here.
Thank you, Shobaji. Saniji, please go ahead.
Thank you, Kishore, for your kind introduction. I'm a pediatrician. I've been in practice for about 42 years. Feel very honored and privileged to be part of this panel. So nothing more to say. Thanks a lot.
Thank you so much, Kishore, and for you to be here, all of us. Like Saniji said, it's a big honor for us to be on this platform, and we heard so many wonderful, inspiring speakers before us. My approach after doing around 3 decades into medicine is the consciousness-based approach to health and wellness, and more into the community settings. And how can we make impact? Because in the beginning what I studied, if I use the same knowledge, is not as empowering or impactful for the individual. And one question came to my mind is that there are so many scales to measure stress and negativity, but there wasn't one scale which will tell me how positive I am. And it was very shocking revelation that there is not one single formula which can tell me how to cultivate the positivity. And then I thought maybe that's an area I would like to focus, and then that also helps us into the prevention and all the dimensions of lifestyle, how we eat, how we think, how we support each other into community setting, and also make the earth like a living heaven for all of us, where there is peace for everybody and everybody's received what they deserve, and you feel accomplished into this whole area. So that's kind of the area I always want to accomplish something into as we go.
Thank you, Sachinji. So, Sunnyji, I know, while you're so busy with all the primary work at the university and the hospital, I know you spend a lot of time on the community service. I know you're closely associated with the Heart to Heart, and you've been doing a lot of great work. Just wanted to, share some of the work with us, and you want to talk about it, please.
So, similar to the last speaker, children is our wealth. Children is our future. And that's why this, I feel very privileged that I've had the opportunity to be an advocate for children. I've been accused as a relentless advocate for children, even in the New York Times. It was meant as a criticism, but I took it as a compliment. And so I think, like Wendy said, if you educate a girl, an educated mother will never have uneducated children. An educated father may always have uneducated children. That's it's a key observation. And now the World Bank and all the other economic sort of entities are recognizing that. So I've been in practice for 40 years, and every year or every other year I've gone back to India and tried to look at how we can improve healthcare in rural settings. And I can tell you nothing has worked. Nothing works in a sustainable, long-term manner. Like building education, you can build a school, you can build infrastructure, etc. But how do you build health and wellness, and particularly in rural communities where there is nothing? So we've done medical camps, we've done mobile clinics, we've done, telemedicine, you name it, everything has been tried. Even the government has spent billions of dollars building primary healthcare centers, but there are no doctors over there. 76% primary healthcare centers don't have a doctor. So I just want to share one particular project that is transforming rural lives forever. And this is, managed by the Heart to Heart Foundation. This is just a quick summary of the activities. Today, 3 million children are being given breakfast every day. In children, growth occurs when they are sleeping. So when they wake up, they have no metabolic reserve. If they go to school hungry, everything, their brain cannot function. Everything gets broken down in order to allow the brain to, get some education. 3 million children in, 40,000 schools are getting daily nutrition, have been for the last several years. 5,000 students in rural areas from poor rural families are getting free education, completely free of cost, no hostel fee, no tuition, nothing at all. And, in the healthcare system, we started with one hospital in 2012. Now there are 15 hospitals, not only in India, all across the world. And this is where the healthcare numbers, come from. It's now up to 500,000 lives being affected, and, 28,000 pediatric cardiac surgeries being done and things like that. So this is, particularly our congenital heart surgery program, mainly in India, Sri Lanka, Fiji Islands, and Nigeria. That's where, in addition, we've done, similar programs, but on a temporary scale in many other countries, 18 other countries. There's a pregnant mother and child health program. The numbers are there. It doesn't matter what the number is. When you change one person's life, you change 10 other people in the family, in their community, in the neighborhood. And so we can go on and on about those stories. Right now, I want to talk more about the rural medical campus that's being built has been built in the Mudenahalli village, Chikballapur district, just north of Bangalore. It's Karnataka. Over here it says India's first rural medical college, but it's the world's first rural medical college, completely free of cost, which is built simply for training children from villages to go back into their communities and serve there. And so phase 1 is what the Sarla Memorial Hospital, phase 2 is the academic block, and phase 3 is still under construction. It's the Sarla Memorial Hospital, and here are the numbers: 360 beds, 6 operating theaters, all these surgeries, doctors, outpatient, all these different departments, visiting faculty, etc. This is the Rajeshwari academic block, which is the free medical school. No tuition fee, no hostel fee, no fee for food, no clothing costs, nothing. The children can come in the 2 pairs of clothes that they came and leave 5 years later with an MBBS degree. But they have to serve in villages for 5 years, as many years as they got this thing. It's not only doing that, it's offering the MBBS course to 50 students, nursing course to 60, anesthesiology, optometry, imaging technology, lab technology, theater, operation theater technology, and then there are postgraduate courses in general medicine, surgery, anesthesia, pediatrics, and OBGYN. All of these things are active right now. This is the first year and completely free of cost. It's a radical model. And this was actually inaugurated by Prime Minister Modi on March 25th. So, I think together we can do our little bits. But what this TAL Kindness Day is telling us, if we all join together, all the little drops can become an ocean. Thank you.
Thank you, Sunny. And thank you for sharing these numbers, staggering numbers, and great contribution from the foundation. And I think that really leads to our discussion today about promoting healthcare and wellness equity, and how can we make it happen, right? With that, I would like to start with all the efforts and experience that you have building this entire infrastructure. What are all the typical challenges that you have encountered in understanding the challenges, and so that you're building some of this help and support for less privileged. Can you share some other areas that you think we all should collectively look at it to support these people?
I think it all starts from this realization from within. All change will happen within. And once we come to the realization that there is none other, that there is a Vasudev Kutumbakam, that the entire world is one family, we will take care. If my brother has a need for a surgery and comes to my ICU, am I going to charge money for him? So that's the change in heart that we need to happen. There will be challenges, of course. In specific locations have different challenges. Like they found in Nepal, getting to the place is so difficult. Some place there is no water, some place there is, extreme levels of fluoride in the water, or whatever other challenges. I think the solution has to be, there are 3 things. One, the solution has to be specific for that village. 2, the solution must involve the villagers. It must do what the villagers want done. It's not like a non-profit goes there and they do something and then they leave. That place is not this thing. When I had finished high school, we went and lived in a village for 2 weeks. And we said, what do you need? This was a Harijan village. They didn't have any road to the village. So we built a road to that village. At the end of those 2 weeks of hard labor in the summer sun, in India. The first time a mobile ambulance came, and in the 100 years since that village had been set up, that was the first time that medical care was delivered. Every person in the whole village was seen. The third thing is that whatever we do, it has to be sustainable. So these are the three things, specific to the village, must include the villagers and do what they need, and third, make it sustainable somehow. And that is the key issue.
No, thank you. I think as you rightly said, most of the efforts, people do it, but if they don't sustain it, then it's not going to be useful for a long time, right? So you want to add, from your perspective, how can we help communities?
So the way I look at it, I know we have all been speaking about education and health and building hospitals, such wonderful things by various foundations. In my opinion, there are two key factors. One is social disparity, which is what you're all addressing. But there is one more thing which I think that needs to be addressed, is the cultural disparity and the stigma associated with certain things. That should, as Dr. Sunny was mentioning, that should be a change from within. And I think for that we need to understand the cultural shift in any society that we are working with and figure out what kind of stigma. The reason I'm talking about stigma, since I talk about cancer all the time, that's kind of my advocacy. I see that people, it's almost a taboo in many households. They don't even talk about it, depending on the culture. Especially in Asian cultures, we don't really share that information. It took me quite a while to write my book where I come out with my story, right? That stigma has to be broken. We need to get out of that. So even if we go and try to help people, it's a problem. For example, as I was telling you before, I volunteer for Cancer Institute Foundation, where we have built 3 cancer screening centers in the rural parts of Tamil Nadu. And in those centers, there are a set of people who go educate the villagers, bring them in for screening, some basic screening, and if they have issues, then we send them to the Adyar Cancer Institute in Chennai. So we need to go out there, educate, and bring them, break that mold. I think that is another key factor.
Sure. No, absolutely. Agricultural barrier is definitely one of the key challenges. Sachin ji, with all your background experience in alternate medicine, what do you suggest? How can we promote healthcare and of course the wellness with your experience?
So in my experience, we saw the beautiful quote that individually we are a drop and together we are ocean. So when we meet people, we should bring that ocean in one drop. So give them the sense of who they are and who I am. And I am not different than who he is or she is. And that's what he was talking about. And when we go with that attitude of serving and also go with the attitude of making the change, kind of cross all the barriers, in my opinion, because that's my experience. You forget the differences, but you look at what is the common factor. What brought me here to want to help somebody, and also don't infringe my opinions or what I want to do for them. Ask them what they need and understand their needs, and then we have a good success because then we are a team and we become collaborators with each other. I'm not there to say I know better than you are or I have more knowledge or more degrees. They mean nothing, but sometimes the life experience itself can teach us so many different things. And many a times I always look at people, you ask anybody, even yourself, you reflect within, and the first thing I ask you what you really want in life, happiness and health. But then I ask people, why are you doing things which makes you unhappy in the first place? That's the question, right? So even if we have what we want, in the end, is that really what we need? Right? So the spirituality brings a very powerful dimension for our existence. My grandparents taught us early on that life is a privilege. And my grandfather always said, very few people have common sense, and hope you are one of them. We see when we put our minds to action, we can make miraculous things. Like one person with a mission can transform these numbers, as you see. So the cross-cultural collaboration, cross-platform collaboration, talking to the government entities, raising the concerns, sharing those, but more into the positive manner. To say, not to kind of portray the negative pictures of what the problems are there, but how can we do something in our capacity, even on the smaller level, and then it can become a big movement because it touches everybody's heart. So that will be my take.
Yeah, thank you. I think kind of you alluded to my next topic, right? Like, how do we collaborate to make a difference in the society or the community, right? So, like Saniji, you want to add to some of the problems that you have seen? Like, there are so many aspects or entities in the society, like education, technology, corporations, non-profit organizations. How can they collaborate all together to make this available for all?
I think it's a very important question because there are a lot of silos in the non-profit world because each non-profit needs to reach a certain number of donors in order to stay alive, and sometimes staying alive is more important than getting the work done. And so I think that is the key issue, is it should not be driven by what is the purpose or the goal of my non-profit or my organization. And that applies across all entities in society. It's what is going to change lives on the ground. How will we make a difference? What happened yesterday must not happen today. What happens today must not happen tomorrow. It has to become better. So many great masters, spiritual masters have said, there is no limit to what we can achieve once we give up our demand for certain credit or recognition. If we give up see, even the rain is coming as grace, the grace of divine grace is always raining, showering. We just have to throw our umbrella away. We have to take off our raincoats, and then we will realize the beauty of that rain. So that's what I'm saying, is these silos must disappear. Let's work together. Let's see how we can change lives. Only when lives are changed. The other thing I must mention from my good friend here is, we have a healthcare system which has become a disease management system. Every year there are 200 articles that are published on the global burden of disease or disability or death, leading causes of death. That's not what we want. We want a healthcare system that is focused on health. So instead of looking at what are the leading causes of death, let's look at what are the leading causes of life. And that life, those leading causes are hope and connectivity, respect for each other. Let's co-create those solutions with the villagers, it's not just a problem in India or developing countries.
Right.
193 rural hospitals in USA closed their doors in the last 200 years. Another 400 hospitals are going to close in the next 3 or 4 years. We have to do something to solve this problem. We will never be able to overcome it. And so let's look beyond our own personal agenda and our personal goals to see how we can change lives at the root level, grassroots level.
Absolutely. Thank you, Saniji. I think that's a very important point, right? Not look at the life, right? Not look at the research and all the energy on the death and things like that, right? On the life. I think with that, Shobnaji, I think you've been talking about awareness and how do we even prevent some of these things, right? Having this information, the support system, can prevent certain things. I know you have gone through your experience in your life. If you can share a few things, that'd be great in terms of awareness and knowing these things at once.
Yeah, as they say, prevention is better than cure, and I'm sure that's exactly what both Dr. Sachin and Dr. Sunny have been talking about. When it comes to cancer, prevention is cure, I would say, instead of saying better than cure. And in my experience, I have shared my story in my book. To make it very brief, I had a kidney failure when I was in my 20s, and then followed by a kidney transplant, thanks to my mom, who donated. And then I got cancers, 3 cancers later on in my life. So while digging deep and trying to figure out what was the cause, it was found out to be a herb that I had ingested as a child. For around 15 years, it was a herbal concoction that I was given, which cured for whatever I was taking it. But instead, it caused organ damage and also inadvertently, unfortunately, a couple of cancers as well. Luckily, I'm alive today, and this is one of the reasons why I do health advocacy a lot, making people be aware. Number one is creating awareness about the basic needs, and which is what all the foundations are doing, and everybody is coming together here today to create that awareness. The awareness I am talking about is, as an individual, you be aware of what you're taking, and in our race for life, and as Dr. Sunny mentioned, when you are looking for life, just be aware of what you're doing and work towards that. And I think that awareness is very key, and we have to build it. Because for me, I learned it the very hard way, unfortunately. But I really want everybody to just reflect and think about what you want to do, and before you take any medications, think about how you want to. And as organizations, I think we have to get that to the next level, where we go to the villages or rural areas. Actually, this is not even about rural areas. This is about everybody, everywhere, all over the world. We have to take that extra step and create awareness among individuals to understand that something, in my position, when what I understood was something natural need not be safe. So the same thing, there are so many other things, so you have to understand and create awareness among ourselves.
No, thank you, Shobaji. Thank you for sharing that information, because I hope this information is useful for a lot of people. When I first time heard about it, it was really enlightening me in terms of how people are using different medicines without knowing what they're really taking. Of course, like most of the medicine, regular medicine is already developed through research and innovation, but there are so many other medicines people are taking without any proven data behind it. So really is very inspirational, and thank you for sharing the data. I know there are a lot of programs is being it's been done by so many non-profits, governments, and other organizations. How do we measure the effectiveness of this initiatives, and how do we ensure those programs are really reaching to the people who are really in need, rather than wasting money or not really reaching to the people? What is your suggestions or thoughts, Saniji?
So I think we need good measures of wellness. Being free of disease, disease-free is not the same as being completely well. And I think those measures still need to be developed. That's why at Stanford I've opened the Child Wellness Lab, and we're doing cutting-edge research on this in this area. I think that is one. I feel that if we are launching a program, then we need to measure what really matters. In order to choose what really matters, we must ask the beneficiary. I'll give you one small example. For many years, we've measured, children who have asthma. We'll see how many times they come to this emergency room, or how many admissions they have, or how much drugs they are needing, how much steroids, how many courses of steroids in 1 year. Those were the parameters. But then we asked the parents and we asked the child, what's important to you in your asthma? The child says, I can't go to my friend's place for a sleepover. So we have to ask the beneficiary as to what's important to you. I can't play soccer. What's important to you? So we have to ask the villagers, we have to ask the student, what is important to you? And then build our measurements from there. In a utopian world, I think, and we are slowly getting there, there will be access to those kinds of things, and perhaps not maybe artificial intelligence, but real intelligence lies in trying to connect with each other, so that sometimes even words are not needed. You just intuitively know what someone who is non-verbal and non-communicative is trying to convey to you in their heart space. So we were sitting in this space of the Heartfulness Institute. That heart-to-heart connection is so important, no matter what we do. It's like the little drops of rain forms a little rivulet and becomes a stream and then joins the river and becomes an ocean. Similarly, whatever we see it with love. Whatever we speak it with love. Whatever we eat, we hear, we talk, we teach, we do anything, we do it with love. And those little drops of love will start joining together and it'll become a stream, a river of love that is flowing through our heart and flowing to everyone around us. That is what we need, I think, in terms of measuring the outcomes.
Sure. Thank you. Sachinji, your comments on how do we measure the effectiveness of the programs?
So I think I will take on where he left. So usually, mostly as we live in Silicon Valley, the common word is hurry, hurry, hurry. Right? Everybody's running. You ask them, where are you going? We don't know. Because he's running, I'm running. So I said, let's change the spelling from H-U-R-R-Y to H-A-R-I and find the divinity within ourselves. So when I meet people, I call the consultation as appointment with ourselves. And I ask them 3 questions. Who are you? Where you come from? And where are you going? And when we know the answers to these 3 questions, we know the meaning of life. And then we can touch a life easily in any circumstance.
Any closing comments on how do we measure?
I think they covered it beautifully with regards to wellness and really touching a life. And I'm sure it's overflowing with kindness here today. But to be on a practical scale, I think we just need something that is scalable and sustainable. I guess that is what would make the maximum impact on whatever we are doing. That is from a practical standpoint.
Sure. Thank you so much.